welcome to Talk Trillium, Partnering for Patients. I'm Patti Cochrane, Senior Vice President and Chief Innovation Officer at Trillium Health Partners, which includes the Credit Valley Hospital, the Mississauga Hospital, and the Queensway Health Centre. I'll be your host today as we take a look at how our hospital is working to create a new kind of healthcare for a healthier community. And speaking of healthier communities, today we're going to talk about the Healthy City Stewardship in the city of Mississauga. I'm really pleased to welcome our guest today, DiEmanuele. She's our president and CEO of Trillium Health Partners, but she's not only our president and CEO, she's also the chair of the Healthy City Stewardship. So, Michelle, tell me a little bit about how the Healthy City Stewardship got started and what is its purpose?
Well, first off, Patti, let me just welcome you and to thank you and Rogers for having an interest in healthcare in this community. I think this forum will allow for great sharing of information and debate on issues over the coming segments ahead. And I think that's a real indication of the importance of healthcare in this community, and that Rogers and you place on that dialogue. So thank you for that.
Yes, we're really excited to share more about what the organization is doing with our community.
So let me talk a little bit about our Healthy Stewardship Center. So first off, in Mississauga, we have this tremendous group of people at all levels of all organizations across the city that are really interested in healthcare. And almost a decade ago, our mayor, Mayor McCallion, and our university, the University of Mississauga, Toronto, Mississauga, they sat down and said, this is an area that we need to tackle. With an aging population, with a diverse population, with a growing population, getting ahead of that health curve is going to be critical for individual and community success. And so the university and the city band together and started to bring leaders together. This is over a decade ago, to start to think about how we could stay as healthy as we can in this city of Mississauga by bringing all of the attributes of our determinants of health, whether it's our socioeconomic determinants, our physical, our mental, our spiritual determinants. And so I just really want to give a bit of a shout out to the University of Toronto, Mississauga, and to our mayor and our council at that time, who stood up and said, healthcare matters, health matters in this city.
So you mentioned the mayor. Can you tell me a little bit about the role that our Mayor Hazel McCallion played in the Healthy City Steward Initiative? So,
you know, all wonderful ideas always take both leadership and vision. And although there have been many leaders involved in, and I know the mayor would agree with that, there have been many leaders involved in bringing this to where it is today. It takes the germ of an idea and the courage to take that idea to the next level. And you know, our mayor, along with the leadership at the University of Toronto, Mississauga, really are at the heart of this vision for our city. We have a vision for our city to be world class, and it is world class. But that isn't just about the industries we attract or the jobs that we have. It is about all aspects of our city, and that's the environment, it's our healthcare institutions, it's our education institutions. And I have, no concern in saying that the heart of this idea and the soul of this idea and the energy behind this idea rests at the foot of our Mayor McCallion.
So tell me, who sits around the table and who's involved in really trying to shift the city of Mississauga to be a healthier community? How do you actually do that?
So it was really founded on the principle of collaboration and also on the principle of a holistic approach. And so, the hospital is really only one member of a very important group of leadership around the table. So the collaboration, as we know when we're talking about healthcare, starts in those early years. What it means for our children in the environment of education and our schools. It starts with the interaction with our justice system and the interaction with our police and their interface with schools and with healthcare. It it's our education, higher education systems. Our Sheridan College, a very important institution in our community, is at the table. The university I've mentioned, our public health members, our United Way, Peel United Way. This is a diverse set of leadership coming together, and we all share something in common, and that's what binds us.
It's a very unique gathering of individuals, isn't it? Because people are coming from all different sectors, hospital sector, public health. It sounds like police, the university and education coming together to really—
Social services.
Yeah, that's really a unique idea.
And we're bound by that goal of better health and living as healthy as we can for as long as we can.
So sometimes these ideas just start up and then they disappear. But it seems to me that the Healthy City Stewardship has had a long history of coming together and continuing to work forward. So how long has it been in existence?
We're just entering into our second decade.
Wow, second decade.
And we've been recognized
That's sustainability.
That is sustainability. and I certainly, as the incoming chair, have that legacy that I'm able to build from. And so I congratulate those who've come before us. And at the heart of that is, again, our just absolute passion for delivering a holistic approach to better services and support in this community.
So later on in the show, we're going to add a few more guests to this table, and we'll hear more about what they've done to change the city of Mississauga and make it a healthier place. But in the interim, I just want to ask you a little bit about the Institute for Better Health that you launched at our Trillium Health Partners, and the role that that Institute for Better Health will have with the Healthy City Stewardship Center.
So the Institute for Better Health at Trillium Health Partners is really predicated on working, again, in a holistic way with all of those partners that help to build a system of care, whether that's inside or outside the hospital. And so you can see the natural synergies to a center like the Healthy Stewardship Center, which is mandate is about mental, spiritual, and physical health, with an institute which is researching solutions to advance that. And so these two things really will work, I believe, quite effectively together to develop solutions to real problems and real system challenges.
You know, it seems to me the key is around partnership and collaboration, and the more that we can integrate and work together to solve some of these problems, because we all know that health isn't just about health, it's also about social and physical and mental well-being. So it has to be a holistic solution. And I think that's part of the mission of creating a new kind of healthcare, is finding those partnerships that will work, and we can all work together as we advance health in this community. So what are some of the issues that the Healthy City Stewardship Center will be facing over the next little while? You as the chair, you will be kind of steering that agenda?
Well, I think the issues are simple in the sense of being able to define them. We are in this vastly growing community that is exceptionally rich in its diversity, is always faced with a supply and demand challenge. The needs in our community are great, and because of historical reasons, the infrastructure has not been able to keep pace quite as fast. And so whether you're speaking to my colleague, the chief of police, my colleague, the head of the university, my colleague who is the city manager, you know, we talk about this supply and demand issue, which means the necessity to collaborate and leverage is that much more important, and this gives us a venue to do that. I would also say, from in terms of our challenges, one of the things that we've recently made a commitment to is to step back now as we enter our second decade and to ask ourselves this very question: what do we see as the single biggest challenges? And therefore, how can we organize ourselves for this next decade to attack them? And so we have some time set aside in September where all of the leaders will be sitting around the table debating these very questions, and it's our goal to come out of that meeting with a set of new priorities for the coming decade.
So growth will be a challenge over the next little while. I'd say diversity also complicates that, and I'd say probably the aging of our population as well.
We have a unique opportunity or a unique challenge. We are aging faster in this community than anywhere else, almost 130% growth in the next 15 years. But we also have a baby boom going on.
Yes.
We have
We're part of that.
A 50% growth in our children, almost 9,000 births at our hospital last year. And so with that, plus a diverse population, means that we need very, very tailored, customized solutions for our different population groups. And 70% of that population have chronic disease.
So I'm going to ask you a personal question just in our last minute and a half, Michelle. What do you do to stay young and healthy? Can you share a little bit about how you do it? I know, being president and CEO of Trillium Health Partners is no small job. And then on top of that, you're chair of the Healthy City Stewardship. So how do you lead by example?
Well, I think it's a great question. And one, I have to tell you, and I know you'll be speaking with our medical officer of health, Dr. Mowat. I was so compelled a few years ago when he took the leadership to insist upon healthy snacks at meetings and those sorts of things. And so I did do a bit of a conversation, I guess, with myself. And so I've put more physical fitness into my day. Recently took up tennis again. And so I'm trying to get out into our public tennis courts and play tennis with friends and family. Taking the stairs to meetings instead of the elevator. Working health into your daily routine is critical, and of course eating well. And I know we all have that challenge, I'm sure, where we're tempted with desserts, etc., but having a balanced approach to diet. And I think it's one of those things that we, as individuals, we just have to constantly calibrate ourselves.
Excellent. Leading by example, Michelle.
Trying.
Yes, and you're doing a great job. I can actually witness that. So I just want to thank you for your time this morning. I know you'll join us after the break. And for now, stay tuned to Talk Trillium, and we'll be back after this break to continue on about the Healthy City Stewardship. Welcome back to Talk Trillium, Partnering for Patients. I'm Patti Cochrane from the Trillium Health Partners. And today we've been talking about the Healthy City Stewardship. We've been speaking with Michelle DiEmanuele, our president and CEO of Trillium Health Partners and also chair of the Healthy City Stewardship. And joining me today is Dr. David Mowat, medical officer of health for the Peel region. Also Shelley White, CEO of the United Way for the region of Peel, and Deputy Chief Frank Roselli of the Peel Regional Police. So welcome joining me today. And we've been talking to Michelle a little bit about the challenges that we faced just before the break. We spoke about the growing community, the diversity within our community, and sadly the aging of all of us within our community. So I'm just wondering, Dr. Mowat, can you share with us from the public health perspective what you see the challenges are facing us within the city, and how do we keep it healthier?
Well, ultimately the object of everything we all try to do is to help all of the residents of Peel live as long and as healthy a life as possible. And there's so many components of that, but one I think we have to pay particular attention to is the issue of obesity, diabetes, and cardiovascular disease, or heart and stroke. They're all interconnected, and they're a particular concern because the trends are going in the wrong direction. By 2027, more than 1 in 6 of all the adults in Peel region are going to have diabetes. And it's a very significant illness with a lot of complications. It's going to impact the rates of cardiovascular disease also. The trends in obesity, as we all know, are going up. and we have about 30% of our young people who are either overweight and obese. And that's particularly concerning because obesity early in life is much more important than obesity later in life. So all of these things need to be tackled, and they need to be prevented because we simply don't have the capacity to wait until they manifest and then try and fix things up later.
So later on in the show, I think we'll focus a little bit more about the obesity challenge within our city. You mentioned 1 in 6 by the year 2020 will have one of these comorbid conditions or these illnesses.
We'll have diabetes.
Diabetes.
Yeah.
So if we sit around this table and look, you know, we've got 5 of us here, and so I'm just wondering which one of us will have diabetes as we go forward. So that's interesting, and thank you from that perspective. You know, from the policing perspective, what's your view on some of the challenges that we face within this city?
Well, on a policing basis, I mean, our primary concern is public safety. And there are many, many aspects to that. But we find challenges within the community in terms of our aging population, our aging infrastructure, population growth and diversity. And all of those bring various challenges to policing. When we have aging infrastructure and we have a society that is dependent on a car, basically, what we find is we have more traffic congestion, which leads to road rage incidents, to incidents of traffic violations. We see more motor vehicle collisions. And this year in particular, we've seen actually more fatal motor vehicle collisions than we have in previous years. So the aging infrastructure and the growth brings those challenges to the police. And what that ultimately ends up doing is diverts our attention from some of the other aspects that we need to look at in terms of public safety. We like to have our officers out in the parks and in the downtown core areas to ensure the safety of those areas, but we're diverted by some of the other issues that are caused by the growth, by the aging infrastructure, and some of the other facets that are attached to that.
You know, it's fascinating how similar the challenges are in the policing and how they're reflected within the hospital world as well. I think, Michelle, you were mentioning before some of the challenges of the growth. Aging infrastructure is also something that we face all the time. And so, you know, partnering together, because it sounds like we've got similar challenges, I think maybe we can come up with some innovative solutions. So thanks for sharing that. Shelley, I know the United Way has done some research on the gaps within the community services in Peel. So can you tell me a little bit more about what the research has uncovered in this particular region?
Yeah, sure. And the research is fundamental to the investments that the United Way does. They're all evidence-based investments. And you're right, Patti, all these issues are inextricably linked. But what we have found is that there is an increasing level of poverty in our community. Dr. David Helchansky at University of Toronto did some research in Peel region, and he found in 1980, 2% of Peel's neighborhoods had low income. Today, it's 45%. And so we've got a rapidly growing community, as my colleagues have already said, but poverty is increasing. And those individuals that are most vulnerable to poverty, based on research that's been done by the region of Peel, are also the fastest growing segments of our community. Our new immigrants, visible minorities, seniors, particularly senior women living on their own, single parents, particularly women, once again, and persons with disabilities, including physical and mental health disabilities. So what the United Way is doing is we're focusing on the prevention and supporting individuals that are living in poverty to help them get out of poverty by focusing on food security and housing, ensuring that every single child in our community thrives. 1 in 5 kids in our community lives in poverty, and also focusing on mental health services for children, adults and seniors, and then we're also focusing on reducing domestic violence as well as reducing the stigma associated with mental illness, because it's the #1 reason why people don't get assistance, because of shame and fear.
Wow, Shelley, you've really described some of the growing challenges within the region. So we've heard about growth, we've heard about diversity, we've heard about aging and diabetes. And now you're describing poverty and how poverty has really grown from 2% to 45%. So surely I'm wondering how the hospitals are feeling that. Do you notice that trend, that change in our demographics within the city, Michelle?
Well, absolutely. I think it's fair to say that because of some of the lack of infrastructure, I think Dr. Mowat talked about prevention, and the police deputy chief talked about diversion of some of our attention. The lack of infrastructure, the lack of our ability to have attention on prevention, and those sorts of things have meant often the emergency department is one of the only places left for somebody to come. And with that, it means that we have wait times and we have levels of care that may not be the most appropriate levels at that point in time. And so the hospital's working very hard to be able to meet those demands because some of that lack of infrastructure exists beyond the hospital walls. And what I'm really happy to say is that we're working with our paramedic force, our police force, our public health, United Way, to look at all sorts of solutions to be able to build that infrastructure while we're dealing with the most emergent needs on any given day.
So I'd be interested to hear from you, Dr. Mowat, or from Frank, about the initiatives you're taking either in policing or in public health to try and address some of those challenges.
Well, from a policing perspective, and Michelle alluded to wait times in the hospitals. During 2013, the police made about 4,000 Mental Health Act apprehensions in the communities of Mississauga and Brampton. And under the Mental Health Act, the police are required to bring those persons who are apprehended under the Act to a hospital emergency ward for assessment by a medical practitioner. With those numbers being in the 4,000 range, that equates to about 20,000 man-hours for the police service in waiting rooms at hospitals within the region. And so the dollar figure attached to that is about $1 million a year for us to wait for those assessments to be done. In terms of initiatives, the Peel Regional Police have partnered with Carleton University to conduct a research study.
Interesting.
And at the moment it involves the two divisions in the City of Brampton, two police divisions in the City of Brampton and the Brampton Civic Hospital. And we've just undertaken a pilot project with them in order to try and reduce those wait times, thus saving resources, saving money that can be diverted elsewhere in the community to public safety initiatives.
Excellent, excellent. We're going to spend a whole segment, I think, later on in this show to talk about the mental health and mental health challenges.
Yes, so that's one of the initiatives that we have underway. Some of the other things that we're doing is we're constantly looking at ourselves in terms of how we can work more effectively and more efficiently with the resources that we have, because we're all under budget pressures. So some of the things that we have done is we've started up a new call diversion unit where instead of one of our officers being dispatched to the low priority calls for service that we receive from the public, they're actually handled by an officer who is accommodated, who we would have to look for a position other than on the front line of policing, perhaps due to injury and so on, where those officers will handle those calls directly from the police division over the phone or by dispatching what we call a community response unit to follow up on those particular calls.
Right.
And so actually the low priority calls make up about 30% of our call volume, and so we're hoping to take that 30% away from our frontline first responders so that they can deal with the more serious issues in the community.
Thank you so much, Frank. Just in the last minute that we have before we break, I'm just wondering if you can just quickly tell us a little bit about the Peel Public Health and what you're doing in terms of these gaps.
Well, we're trying to make the healthy choice the easy choice. And if you look at, for example, physical activity, we know we could reduce diabetes by 30% if everybody met the requirements, the recommendations for physical activity. Only 10% of adults do that. So how do we do that?
So it takes leadership, I think, to do that.
Well, it takes changing the way we live our lives.
Yes.
And that's very complex, but we're moving towards that.
And so, you know, allowing the city to be a little bit more active in supporting things like biking trails, I would imagine, and I think leaders of big organizations taking a leadership role and being active, as Michelle DiEmanuele shared with us what she does in that effort. So I think it's incumbent on all of us to take that leadership role. So thank you for sharing that, and Shelley, will get back to you, I think, in the next segment about what United Way is doing. So stay tuned to Talk Trillium, and we'll be back after a short break to continue our discussion about the Healthy City Stewardship in the city. Welcome back to Talk Trillium, Partnering for Patients. I'm Patti Cochrane, the host for Talk Trillium. And today we've been talking about the Healthy City Stewardship Initiative. We have a great panel today: Michelle DiEmanuele, Dr. David Mowat, Frank Roselli, and Shelley White, CEO of the United Way. So earlier we talked about the vision for the Healthy City Stewardship Center, and we really have a vision of keeping the city of Mississauga as physically well, mentally well, and spiritually well as we possibly can. So one of the major concerns that we have, that you mentioned earlier, Dr. Mowat, is the issue of obesity within our city. Can you tell us a little bit more about how serious is this problem, and maybe a few initiatives that we're doing to tackle it?
Well, obesity, as we all know, has been increasing, in fact, increasing across the world. What we're doing is to recast that issue as one of supportive environments for healthy living. In the past, I think we've relied too much on telling people to eat right and to exercise more. Well, you've seen the results of that. It doesn't work. So we have to do something else. It's very apparent from research that's been done in the Toronto area that if we have a built environment that supports physical activity, then dramatically we will see lower rates of obesity and lower rates of diabetes. We really have to transform our suburbs from sprawling, car-dependent places to places that support walking and other forms of physical activity. It's vitally important.
So then you're a physician, you represent the public health. How do you influence the ability to create that kind of infrastructure within a city? Because it's not something that you would naturally do as a physician. So how do you get things built?
Well, this is a public health tradition. In the mid-19th century, we cooperated with engineers to put sewers into cities. And this is just, you know, we're addressing now not infectious diseases, but the chronic diseases we see today. So I spend a lot of time talking to planners and transportation engineers, and my staff do as well. We have to increase the density of our cities so they'll support public transit, for example, and get people walking. The answer, I'm afraid, is not recreation. Recreation's a great thing, but not enough people ever participate in it. And even for those who do, it's only about 10% of their caloric expenditure. What really makes a difference, where we've lost our activity over the last, say, 50 years, is what we call utilitarian physical activity, getting from A to B. And we get everywhere by car, and we have to stop that, and we have to walk or cycle. Take children, for example. There's fewer and fewer children traveling to school under their own muscle power. They're driven by parents, they go by bus. And that's a dramatic difference. We drive to work. If we even took transit, we would have to walk to the bus stop and, you know, walk from the bus stop at the other end. So we know that from New York City, for example, that those who take transit less likely to be obese, less likely to have diabetes. It's really the only way we're going to tackle this
So I've
problem.
noticed the city has developed more bike lanes recently.
Yes.
You know, when you're driving along, you see these bike trails. But,
Yeah.
you know, I was in Amsterdam a couple of years ago, and I couldn't help but note the culture of that city is really around biking to work. And so, yeah, it sounds like a change we could all commit to adopting.
We can do it,
perhaps.
but it's very complex
Challenging.
because people cannot bike to work if it's too far away.
That's right.
And if we have sprawling low-density communities, then that makes both cycling and the provision of public transit extremely difficult. Unless we tackle that, we're going to have a hard time really making the difference of getting people active again.
Thank you. Now, Shelley, you know, the United Way has done a lot of initiatives. Can you tell us a little bit more of some of the initiatives that United Way is doing to improve the health of the community?
Well, just building on what Dr. Mowat's just talked about, I completely agree with him about creating walkable, accessible communities. Walkable, accessible communities mean that people can access the services that they need when they need them, right in their neighborhood and when they need them. It also increases community safety because people get to know one another and you build this sense of community. So United Way is actually investing in neighborhood development, and we're working on a project with Peel Regional Police in Colonial Terrace with their community safety model, but we also have invested in 3 communities, one in Mississauga, Sheridan, which is located at Air Mills Parkway in the QEW, in Ardglen in Brampton, which is at Queen and Kennedy area, and in the Exchange in Bolton, in Caledon. And it's all about engaging resident leadership to identify what the gaps are and engage them in the actual solutions. And there's been tremendous success. The residents know what the issues are, they've got great ideas, and when they develop the ideas, in partnership with organizations like ours, they're much more successful because they own them. And it does create stronger, safer, healthier communities where people thrive mentally, physically, economically in our communities.
So you're really talking about social supports as well. It's not just about physical infrastructure, but the United Way, I think what you're recognizing is that people need to feel connected with their community, and they need to know and be able to reach out to other individuals to feel safe.
That's right, Patti, and we need to build that social infrastructure. We've talked about the hard infrastructure that we need to create, but we need to create that social infrastructure as well. There's huge gaps. Our research has told us there's huge gaps in Mississauga, Brampton, and Caledon in our social infrastructure. We need greater investment of funds in our communities to expand the availability of housing, community services, counseling, addiction services, etc., in our communities to help people thrive, after-school programs, etc.
So Michelle, can you tell me a little bit more about, I know the Trillium Health Partners is looking at the issue of childhood obesity. What initiatives have you developed or are working on?
So I just want to echo something that Dr. Mowat said, is that this is an area that we've tried a number of different things over the years, and we're seeing more and more that it just isn't having the impact that we have. So I guess I'll focus a little bit more on the child obesity issue, that prevention piece that, again, I think we all agree is critical. And we're now working on an idea and on a program that would actually have the hospital partnering with the school system to actually bring some of our services right into the school, working with kids in their natural environment in terms of working on type 2 diabetes in kids. And Dr. Bayless, who is our Chief of Pediatrics, and as you know, Trillium Health Partners is the regional pediatric center, is working with many community partners and donors to actually put together a program that we will evaluate that is in partnership with our school system, and if effective, really roll that out where the services and the ability to work with kids in their environment, in their natural environment, outside of a hospital, working on both prevention but also on treatment when we have kids who obviously have been affected by type 2 diabetes. So there are so many areas that we need to be exploring, and I think what I can say is that this is a priority of the hospital, and one where, as we more and more are dealing with chronic disease management, the hospital's resources are being both diverted to areas of prevention, but also in areas of research so that we can actually spend our dollars in the most effective way for the most number of people in our community.
You know, it's amazing to me that how all of us are trying to work on the same things and the same goals. So it's wonderful that there's a partnership with the Healthy City Stewardship Council. Now, we just want to go out to our community. So part of the purpose of this show is to share with our viewers, you know, some of the work that's happening within the city, but also to get a chance to hear from our viewers as well. So we went out to the community and we asked a few questions. And one of the questions that came back was, how can I contribute to make my neighborhood safe? And we all worry about safety within our neighborhoods. I know even within my own local neighborhood, there was a recent event where we all got a little bit nervous. So I'm going to turn this question maybe over to you, Deputy Chief, to think about or to help us understand how we can all make our neighborhoods safer.
Well, the key to that is actually awareness. Being aware of who your neighbors are, being aware of what the normal routines are on your street, and if you see anything that's unusual, please pick up the telephone and contact the police. It may be nothing, but we would rather respond and ensure that it's nothing.
So don't hesitate.
Don't hesitate. Pick up the telephone and call the police. Now, when we speak about some of the tremendous trails and parks and community facilities that we have in the region of Peel and in Mississauga, I'll harken back to what Dr. Mowat spoke of in terms of people who are not voluntarily participating in exercise, unless we have this public health issue that relates to obesity. We have officers who are continually patrolling the parks, and that's primarily our bicycle patrol units. But what they report back to us is that these areas are really being underutilized. We're not seeing people getting out of the house. And so part of the whole public safety thing is we're seeing people who are living in isolation. They are relying on technology for their information and for their interaction, and so they're really not getting out to know their neighbors or know what's supposed to be going on in their neighborhood and what the normal routines are.
So it's reassuring to know that if we get out and exercise, we're also going to be safe when we do so.
Absolutely.
Because you're increasing that patrolling. That's great.
Absolutely.
Now, we had a second question from our viewers, and they said, how can I get my family to be more active? And just when we were on break, Shelley White was showing us something. And so, Shelley, can you talk a little bit more about that?
Yeah, so I received this gift. It's called a Fit Force. And what it does is it actually tracks my activity levels.
You sure?
Yeah,
It's
so
like
it
a
looks just like
watch.
that. It looks just like a funky little watch, space-age watch. And it actually tracks the number of steps that I do, the amount of exercise that I do, etc. And it gives me a readout at the end of each day, at the end of each week. So I can actually track. My goal is to actually do 14,000 steps every day. And this lets me know, and I get a cool little vibration on my wrist when I reach that goal. So it's really encouraging me. And I can tell you, I park farther away, I use the stairs.
Wow.
I want to reach that 14,000 goal. I feel like I have not accomplished what I need to do that day if I don't reach it. So it's really encouraging me. Later on today, my husband and I are going on a bike ride so I can reach that 14,000.
Sounds like a perfect solution.
Yes.
So I'd like you to stay tuned to Talk Trillium, and we'll be back after a short break, and we'll continue our conversation about the Healthy City Stewardship Center. Thanks. Welcome back to Talk Trillium, Partnering for Patients. I'm Patti Cochrane from the Trillium Health Partners, And joining me today has been Michelle DiEmanuele, President and CEO of Trillium Health Partners, Dr. David Mowat from Peel Public Health, Frank Roselli from Peel Regional Police, and Shelley White from the United Way. We've been talking about the Healthy City Stewardship Initiative, and I know mental health has been a big issue, an emerging issue. We've talked in the previous segments a little bit more about mental health, but Shelley, can you tell me a little bit more about what the United Way has done? I believe you've done some really good work on mapping mental health issues across this region.
Yeah, and just to create a bridge to the last segment, we were talking about what we can do as families. And there is a fabulous app available in Peel called Play in Peel app. It's a free app, and it provides you with information about what resources are available that people can access in our community. Highly recommend it.
Great.
So what we found in the mental health research, I mean, mental health is a significant issue in Peel region. 1 in 5 people at some point in their lifetime are going to experience a mental health issue. And so it's extremely important, and it affects children, adults, and seniors, so it affects everyone in our community. And not only does it affect the actual individual that has mental illness, but it affects their families, their employers, their friends, etc. So it does, actually, mental health affects all of us. What we found in our community is, back to the point about lack of infrastructure, there is a definite gap in services, particularly community-based mental health services in our particular community, that people can be linked with once they go to the hospital and get treatment. As you said, Michelle, sometimes the first point of entry is emergency, but then how do you integrate and link them back to community-based mental health services? So we need to build those bridges. We also found that stigma is huge, and it cuts across all socioeconomic, all ethnocultural backgrounds, and all ages. And so we've got to do some really substantive work in reducing the stigma associated with mental illness. We also know that we need to ensure that, given that Peel is one of the most culturally diverse communities in Canada, we need to ensure that our services are culturally and faith-based accessible. So that's absolutely imperative. We need to ensure that the other point of entry for a lot of our individuals with mental illnesses are family physicians. And we were surprised to learn that many family physicians don't have enough knowledge and information about where to refer their patients. So that's absolutely key to creating solutions. We need to tie housing and employment and counseling services to mental health. These are all inextricably linked. We've got to ensure that those services exist as well. So those are the key findings that we found in this research, and we're now working on solutions, and one of the solutions that we're working on is creating community mental health hubs in our community to provide both prevention programs and services, as well as assisting individuals when they do find themselves in crisis.
It seems to be a common theme that you've talked about creating these hubs, and again, I think connectedness and social networks are a big part of keeping our community healthy. I'm going to turn it over to you, Frank, to talk a little bit about the impact of mental health on policing, because you mentioned before some of the challenges that you were facing.
Yeah. Shelley alluded to the fact that about 20% of the population is affected to some degree by mental health issues. We have a similar finding in terms of our calls for service, and that the people we encounter during those calls stands at about the same percentage. Ultimately, what has happened over the years is the police used to be the measure of last resort. Over the past several years have actually become at times the measure of first resort, particularly when it comes to mental health issues. And by the time the police are called, we have people in crisis. And so what we ultimately end up with is having to apprehend that person if they're a danger to themselves or others, are unable to care for themselves, and taking them to a hospital. Or it may involve some kind of criminal act that involves violence or damage or something else, and ultimately that person finds themselves before the courts. And that is preventable. If the appropriate measures are in place to identify the mental health issues, to deal with them before they come to the crisis stage, and the police would never have to be called if we were able to achieve that. So those gaps do exist, and they do impact policing to a great degree. As I said before, we made about 4,000 apprehensions last year under the Mental Health Act, and those are apprehensions that we'd rather not have to do. And because with that comes the stigma that a person has been apprehended by the police, and if they're sitting in waiting rooms of hospitals, under police escort, that brings a further stigma to the people who are involved.
So it sounds like, you know, there's been a shift. It used to be that the police were rarely called, and now it seems like you're first responders almost. So it feels maybe like there's a challenge to access to services, but also recognizing when a mental health issue is rising, and maybe there's a delay. So I know the Medical Psychiatry Alliance has been announced recently, Michelle. Can you tell us a little bit about that and how that might help the city in terms of managing mental health issues?
Well, the Medical Psychiatry Alliance is a new organization that has been formed with Trillium Health Partners. CAMH, our nationally leading mental health institution in this country, Sick Children's, our world-class children's hospital, and the University of Toronto, again a world-class higher education institution. And the four organizations have come together to really tackle a particular segment of mental health as it relates to those individuals who have both a medical condition and an underlying psychiatric condition, or vice versa. And so these are children who may present themselves in the emergency department over and over again because they have stomach aches or palpitations, etc. But really there's an underlying anxiety issue that's maybe preventing them from getting to school every day. Or an adult who may have an anxiety issue which is presenting itself as chest pains. And we do, test after test to try and diagnose these issues. But again, it's much more complex, and there's an underlying mental health issue often that we're dealing with that's manifesting itself in some other way. And so we've come together and with $60 million, $20 million from the province, $20 million from a donor, and $20 million from the organizations, to build a series of solutions for this particular population of mental health that helps educate our family physicians, to Shelley's point, providing them with information and access to information and treatment solutions so that they're not in a position to force patients to go through the emerge just to get to the services and information they need. Working with our medical students at our medical academy in training our new doctors and our care team in ways in which that we can identify this patient population sooner, and also researching these interventions and these solutions so that we can scale them not just here in Mississauga but across the country. So we're very excited by this alliance, and although dealing with a specific population, what it will help us do is build the pathways and the frameworks on how we put more solution in the community, not the hospital, more education in the community, not the hospital, and so that, not unlike the Deputy Chief was sharing, that the hospital is there to support the patient population in those needs that really we are best equipped to do, and that we are using our resources to support the community where they need it most. And so we're very excited by this, and I think the United Way's focus on mental health and the work that they've been doing, and the focus that public health has had and our police force has had historically around this particular population. At the Healthy City Stewardship Center, I believe this will be an area where you'll see further collaboration for many years to come on building a true network of care that is at the prevention side, also at the chronic management side, but has the ability to respond in those most critical and emergent situations. We're very excited about our partnership.
Wow, what an exciting initiative. And it sounds like the partnership goes beyond our region and actually goes into the Toronto academic areas, the University of Toronto as well. Yes. And that makes this almost like a transformation in the way we treat mental health, but more importantly, trying to get and recognize the challenges for these patients earlier in their stage so we can prevent some of the maybe calls to the police down the line. So it sounds like it's a multi-year strategy, it's broad, and it's audacious in its goals of going after primary care, community care, the education of our healthcare providers as well to really improve the treatment of patients.
Maybe, Patti, I can just add, stay tuned. We have a significant event we're planning for the community in this fall. You'll hear more about it, where we hope to bring over 300 individuals, family practitioners, public health, the police, hospital workers, etc., to an event where we can learn from each other and begin to build solutions together.
And although we've talked about the mental health challenges for a long time, I think now it's brand new where we're talking about medical conditions and how it intersects with mental health, particularly around the chronic conditions that you spoke about, Dr. Mowat. In our last 2 minutes, we have an opportunity to again hear from our community one of the questions that they wanted us to answer. And so the question that we have is, how can I become more involved in my city? So in the next minute, Shelley, can you tell us a little bit about volunteering and what that might look like?
Volunteering is extremely important. It builds civic engagement and civic pride, and people feel better about themselves when they do volunteer. Do you know that people that volunteer, there's actual research that they live longer than people who don't? So another reason to volunteer, and there's so many opportunities to volunteer. There is many opportunities to volunteer as there are areas of interest. And so contacting an organization like the hospital, the United Way, Peel Regional Police, but also Volunteer Mississauga, Brampton, Caledon, you can find a myriad of volunteer opportunities in our community for people of all ages, from kids right through to seniors.
Well, there was so much that we talked about today and so much more that we could be talking about, but our time has run out, unfortunately. I just really want to thank the panel for coming today. You're definitely experts in your area, so thanks for your contribution. For the viewers, if you want any more information about any of the programs, you can find it on our website, trilliumhealthpartners.ca. And thanks for joining us today. We'll be back another day.